Hi everybody, my name is Christian Reyes. Recently new grad nurse, December of 2015. I've been working on the orthopedics and trauma unit at UMC for about a year, a little over a year barely. Um, don't really have much community experience aside from nursing school with health fairs that we used to do and the health clinic that EPCC has. Um, So I think my goal and mainly just working on my unit, I've seen a lot of diabetes related complications, mainly diabetic foot ulcers, and I know that's a really big epidemic here in the city. Um, the diabetes leads to neuropathy, retinopathy, renal failure, the diabetic foot ulcers, amputations, um, and I think we just need public education. I know that the city is really good about it. Um, but I think the community needs to change its mindset and its perspective, and I think we need to start small and then hopefully aim big to change these things because these diseases, especially the amputations, I mean they're really preventable, and I think the city as a whole has a mindset that's wrong, and they see it as diabetes as genetic and something that we're not going to get away from. Oh, my grandma has it, my mom has it, my sister, my brother have it, um, and it might have a genetic factor, but I'm pretty sure it's mainly related to our cultural attitude and the obesity rates here and the foods we eat that nobody here wants to exercise. Um, and I think we need to change that stigma. Um, I think public education is the main focus, and I think this course is really going to help with that in my nursing career. I think I'm going to focus on diabetes for my project. Um, I think some things that need to be changed are like resources. I know the city's been doing really good. There's a lot of resources for diabetes. I've been noticing in the Far East where the new houses are being built. Um, Lots of parks everywhere. Every block has a park. There's always people outside. There's a bike program in downtown. I think we need to make like more dog parks, more anything that can have people outside socializing, getting exercise. I think that's a plus. I think the city needs to focus on things like that. I think us as nurses, we need to focus on health fairs and education. It's always education, nursing, or just pretty much teachers. We educate constantly. Um, I think the community needs to be more open about diabetes um, and understand. I think they need a really rude awakening to the complications that can happen. I just speaking to my grandma who has diabetes, she walks around outside barefoot, and I'm telling her the things I see at work just from thorns or cuts. These people have amputations and they're losing toes, foots, legs, and even her, if I can't change my family's mindset, what makes me think I can change the community? But I'm just trying to show her, and I think we need um, more graphic ways of showing these diabetic patients the complications that they can have, and really changing their attitude towards things, their attitude towards diets and exercises, and like I was saying, just this cultural attitude that everybody has here of, oh, being overweight and having diabetes is just a norm here, and it shouldn't be. We should be a really healthy city, and we can be. There's nothing different from us from other minorities and communities, except for education and the mindset. And I think that this course and this project hopefully will help me curb that, because I'm getting really tired and really annoyed of working in my unit and fixing patients, but we're just bandaging them, we're amputating them, and we're sending them off on their way without learning. And they're not changing their perspectives, and they're coming back, and their amputations are getting higher, or they're amputating another foot. And instead of having this life changing experience to where they want to better themselves, I've seen patients just close off and do worse. They're not changing anything about their diet. They're not exercising. They're they're bitter about it. Like if it's anybody else's fault but their own. And I think they do need help, but we need them to help change themselves and help be like the catalyst to their own health and bettering themselves. And I think the hospital's nice and we're fixing people, yes, but I think we need to get ahead of that out in the community and stop the issue before it gets that far, before we're in dialysis and before we're cutting off limbs. And hopefully this course will help me with that. Thank you guys.